Welcome back to the program. Coronavirus symptoms for the feared Delta variant are more like a cold for the majority of sufferers, experts have revealed. A headache, sore throat and a runny nose are now the most reported symptoms for those with COVID-19 in the United Kingdom, overtaking a cough, fever and a loss of taste or smell. Dr. Moni Gasper is a general practitioner in the United Kingdom and she joins us now. Thank you for joining us on the program.
Thank you very much. Good evening.
Good evening. I know the last time we had you on the show, you said we are all looking forward to the ease of phase 3 of the lockdown. But what do you make of the extension yesterday, and will it be enough?
I think it's a very difficult situation for everyone. The Prime Minister really didn't have any choice but to look after the entire population. So far, we have 3.8 million deaths in 200 countries across the globe. That is not to be laughed at. It's a serious pandemic we're still in, and we need still to take all adequate measures. Right at the beginning, the Prime Minister did say that lockdown would be eased based on 4 main criteria, and he's reiterated this over and over again: the number of deaths, the speed of the rise of infections, and the hospitals being potentially overwhelmed. So we need to prevent that before it happens, and that's the reason for this. Will it be enough? We hope it will be, but the truth is we don't know. It all depends on our behavior, on surge testing, on vaccinations getting into people's arms, not just in the UK, but globally as well.
So it isn't lockdown that is the solution. The pandemic remains. But where is the UK in terms of vaccination? Do you see the government vaccinating everyone before the 4 weeks is over?
The government is actually ahead of the game in terms of the vaccination. They met their initial criteria for all the vulnerable people to be vaccinated by the 15th of April, and they're actually ahead for the second batch of ages to be vaccinated. Just today, they've announced that by the end of this week, measures will be put in place to invite everybody 23 and above, and by July, all 18-year-olds and above will also be offered a vaccination. So in terms of the vaccination, the government is well ahead. The problem is not just about who's vaccinated in this country. So far, over 50% have had both doses of their vaccine, and a little bit more have had at least 1 dose. But we know that with this variant, the Delta variant, a single dose is not sufficient. So we do need other visitors coming into the UK to also be vaccinated. It's a global problem. It's not just a UK problem.
So let's go on to the Delta variant you just mentioned. Scientists are worried. In fact, a member of the Scientific Advisory Group for Emergencies said that the number of people dying from coronavirus, that it would rise. Are you worried about the way COVID seems to present itself now, which appears to be quite similar to a common cold?
That's absolutely right. But if you remember, even with the first wave, the first set of lockdowns at the beginning of 2020, not everybody presented with the same symptoms. You know, the classic symptoms described were the cough, the fever, and then soon after, loss of taste and smell were added to it. Soon after that, several other symptoms, until it's got to a point that for my colleagues and I, it's a situation of think COVID, think whatever the presentation of anybody presenting unwell, think COVID until proven otherwise. COVID can present in all sorts of ways. In the first wave, children presented with tummy pain, and that was not amongst the classic symptoms of COVID. When I had COVID last November, I didn't have a fever, I didn't have a cough, I was just very tired, which I attributed to just being overworked and not resting enough, but it was COVID. So COVID affects every organ system and can present in any way at all.
Just before we ask about perhaps the non-pharmaceutical protocols that's happening in the UK, what's your take on what's happening with the rest of the world with regards to how they're handling COVID-19, seeing as, you know, vaccines are not getting to some regions of the world?
I think that generally the situation globally is more in terms of human behavior. Vaccines, yes, we don't have enough doses for everybody that needs, but there's still a lot of complacency in terms of our behavior, in terms of social distancing, wearing masks. Those go a long way to try to protect individuals. Certainly, vaccines are the way out of the pandemic, but we also need to take into account all the other measures that are available, the other public health measures that are available to us. We can't emphasize enough educating the public in terms of what we need to do. Vaccines are helpful, but we do know everyone can't have the vaccine for one reason or the other. So for us to achieve some sort of herd immunity where we cover the general population, then we do need to take into account all the other measures possible. And personally, I think that we can do a bit more in terms of public health measures.
All right, I would say that you've answered the last question, and that is with regards to what would you say is how high is the level of the non-pharmaceutical adherence in the UK?
Unfortunately, it used to be better. And I think, again, down to human nature, everyone has slipped a bit. We're all suffering to one extent or the other with pandemic fatigue. So we don't really like to wear masks as much as we should, and social distancing has been difficult at the best of times. And now that there's hints of the lockdown easing, everyone seems to equate that with you can socialize a little bit closer proximity, but that is not the case. And we can see by what is happening. And this Delta variant in the UK has affected more of the people who haven't been vaccinated and people who've only had one vaccine. The people who have social distance continue to social distance because I guess it's become a bit of a habit now. So that is important to maintain.
All right, I guess that's a message to the rest of the world, the importance of the MPIs at this time. We'd like to thank you, Dr. Moni Gasper, General Practitioner in the UK. Always a pleasure. Thanks for joining us on the program.
Thank you very much, Millicent. Thank you.